A 36-year-old man in China went in for a simple weight loss surgery and never came out alive. His goal? To look healthier before meeting his girlfriend's parents. But just days after the operation, his heart stopped, his breathing failed, and he was gone. And the worst part is this: the signs were there long before the surgery even began. This case comes from Henan, where a man known as Li Jiang weighed more than 130 kilograms and stood about 170 centimeters tall. Doctors told him he qualified for gastric bypass surgery. He checked into the 9th People's Hospital on the 30th of September, went through pre-op prep, and went into the operating room on the 2nd of October. Everything seemed okay at first. He moved from ICU into a general ward. Nurses said he was stable, and his family thought the hardest part was over. But at around 6:40 a.m. on the 4th of October, everything collapsed. Li suddenly stopped breathing. He was rushed back to ICU, placed on emergency treatment, and monitored closely. For one brief moment, it looked like he might recover. Then on the 5th of October, his body could no longer cope, and he died from respiratory failure. Later, it was revealed that Li had serious health issues even before the surgery: metabolic syndrome, high blood pressure, and a fatty liver. All of these conditions make major surgery very risky. His family now questions if the hospital gave a full and honest briefing about the dangers, or if they acted fast enough when things went wrong. They said Li only wanted to look better to impress his girlfriend's parents, and that the surgery was not a medical emergency. Doctors at the hospital insisted that he met the requirements for weight loss surgery, and said they would take responsibility depending on the outcome of the autopsy. That report is still pending, and the exact cause of death is not confirmed yet. But the case has triggered a huge debate online in China. Many people are asking if cosmetic reasons should ever push someone toward a high-risk procedure. Others say hospitals should be more careful when dealing with vulnerable patients who might be driven by pressure, not health needs. And it raises a bigger question for all of us. When someone is desperate to change their appearance, how much responsibility does a hospital have to slow things down and make sure the person fully understands the risk? Let me know what you think. Should elective surgeries like this require even stricter checks, especially when the patient has major health problems? If you found this breakdown useful, do like, share, and subscribe to 2230 for more in-depth stories and sharp analysis.